As many of you know, June is also Men's Health Awareness Month. Therefore, I will be doing my presentation on men's health. What is men's health? It refers to a state of complete physical, mental, and social well-being as experienced by men, and not merely the absence of disease or infirmity. Statistics on COVID-19. It has been well publicized that COVID-19 discriminates by age and by underlying health conditions, but it has become increasingly apparent that it also discriminates by sex, with the latest UK data from the Office of National Statistics revealing that men are almost twice as likely to die from the disease. Trends were first noted in China, where one analysis found a fatality rate of 2.8% in men compared with 1.7% in women. Since then, the pattern has been mirrored in France, Germany, Iran, Italy, South Korea, and now in the UK. In Italy, men have accounted for 71% of the deaths. In Spain, data released suggested that twice as many men as women have died. In the UK, of the 4,122 deaths registered, 2,523 were men and 1,599 were women. Why are men more prone and likely to die from COVID-19? Some suggest genetics. The extra X chromosome in women give them a stronger immune system and response to infections than men. A recent study published on May 10th reported that men have higher concentration of angiotensin converting enzyme 2 in their blood than women. This enzyme enables the coronavirus to infect healthy cells. This may help to explain why men are more vulnerable to COVID-19 than women. They're more likely to have pre-existing conditions, which makes COVID-19 more dangerous. Men thinking they are invincible, which underpins a lot of behaviors. They tend to be less compliant with pandemic-related restrictions such as physical distancing. Men work outdoors, which exposes them to conditions associated with extreme climate and pollution, delay in seeking medical attention, and smoking. Symptoms of COVID-19. These symptoms may appear 2 to 14 days after exposure to the virus. The following may be symptoms of COVID-19: fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Ways to decrease the spread. Practice good hand hygiene. Wash your hands. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Cover your cough and sneeze. Practice social distancing. No large gatherings and remain 6 feet apart. Stay home if you feel sick. I highly encourage wearing a mask when out in public. What if I am sick? If you have a fever, cough, or any of the listed symptoms, you could have COVID-19. Most people have a mild illness and are able to recover at home. If you think you may have been exposed to COVID-19, contact your healthcare provider. Keep track of your symptoms. If you have any of the following emergency warning signs, get emergency medical care immediately. Symptoms include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. The take-home message: gentlemen, it's time to step up your health game and get yourself to the doctor's office more than once a decade, and quicker if you notice symptoms concerning for COVID-19. Thank you and be safe.